Healthcare workers will soon have the expertise to redesign their job roles to better serve their patients and enhance their own career prospects. This made possible by a new workforce accelerator program. NHG Health says such redesign is more urgent than ever as health demands shift rapidly and tech becomes more involved in work. The Workforce Accelerator program provides healthcare workers a structured four-stage process. They look at what patients need, how an existing role can be redesigned to meet the needs, and if not, what new roles can be created to fill the gap.
To be able to meet this rapidly changing needs of our patients as well as residents, our workforce will need to acquire the agency to be able to review their work and job tasks and to be able to reimagine how the future care models is going to be like. What are the future needs of their patients and residents, and then be able to do work redesign in their own settings.
36 redesigned roles have been developed and expected to be in place by 2036. They include a new role that will enable surgeons to perform operations remotely using robotic technology. Senior Minister of State for Health, Tan Kiat Hao, says such tech strengthens doctors' expertise, not replace it.
Our challenge is not simply responsible AI. It is responsible professional development in the age of AI. We have long understood the risks of de-skilling. Today, we must also guard against mis-skilling. People becoming highly proficient at using technology, but less confident exercising their own judgment. Patients deserve better than that. Our healthcare professionals deserve better than that too. Technology should strengthen expertise, but never replace it.
Singapore residents will soon be able to manage their healthcare through a single app. Public healthcare apps, including the SingHealth Health Buddy app, NUHS app, and NHG Health app, will be consolidated into an enhanced HealthHub app by November, with the existing apps phased out by February next year. And for more on how human-centric sectors like healthcare and social services are navigating the use of tech, we're joined by Bruce Liu, who is Senior Director of Disability and Inclusion at AWA, as well as Stephen Goh, who is Executive Secretary of the Healthcare Services Employees Union. Gentlemen, welcome to the show. Now, Stephen, let's start with you. Healthcare and social services are sectors where the human touch is crucial. So how can tech tools like AI help workers with their jobs without also losing that human touch the industries are known for?
Thanks for that. Yeah. So over the last 2 years, Healthcare Services Employees Union has been working together with our management partners on many of the CTC projects. CTC is where we actually fund the hospitals to do enterprise transformation, and as they do transform the hospitals itself, they will also transform the workforce. So we have amassed many projects, and I would say that actually the large number of them are actually not so much of the AI projects, but there are some about maybe a ballpark about 20% of those projects that are involved in the CTC itself, utilizing complex AI like agentic itself. So one of the very good example will be Tan Tock Seng, whereby they actually have a smart rostering system. And smart rostering system is very important because it will be able to help the nursing officer, a nursing manager itself, to actually elevate a large part of their time planning the roster for the next 4 weeks. So what happened is that typically in the roster system itself, they will have to match the supply with the demand, and then following a set of rules, and with the number of the complex number of shifts right now because of the flexible work arrangement, they are now able to leverage on the AI to actually help plan out some of these requirements as the doctor walk the wards as well. And that's only the first phase that we are in. Coming to the second phase, I think that's when agentic comes in to actually do roster repair. So for instance, if there are some unplanned absences that happens on the day itself, then a press of the button, the agentic agent will be able to go into the system and pick up what are some of the nurses that are on call with the relevant competencies and able to then surface these names so that the nursing manager can now actually select them. So all these will elevate a lot of their time. And with that, I think the nurses will have better job satisfaction and therefore able to have a greater staff retention in that sense.
Right. So we have to go over to Bruce now to ask what makes tech adoption more difficult for AWA and also the wider social service sector?
I think in social service, right, a lot of work starts from human vulnerabilities, right, which is why trust is very important. And if technology becomes the first touch point, it sometimes makes the client feel less seen, less heard, less understood. So professionals are quite cautious in introducing tech before the trust is built. The other thing I think that was mentioned by Stephen earlier is the complexity. Here in AWA, we advocate holistic care. So we look at all aspects, all needs of a client, biological, psychological, social, spiritual. And at the same time, the care is delivered by various professionals and specialists working together. So while the practice may be interconnected, systems may not, and that also slows down adoption. And one last point, of course, is as you have seen, a lot of care, a lot of intervention, it's very individualized. And sometimes technology starts off by standardizing processes, and that may not be so well received by frontline teams.
Now, Stephen, let's go over to you again. What areas of healthcare work do you think are most ready for AI adoption, and which parts still require a more cautious and measured approach?
Actually, very interestingly, AI can be applied anywhere and everywhere. So again, based on the past CDC projects, they have been applied through the clinical, they have been applied through nursing, they have been applied through allied health. And we're also seeing some AI projects in the operations, such as the facilities management, kitchen, and so on and so forth as well. So in fact, it is very versatile and flexible. And even without AI, I mean, some of the roles will also have to be transformed, as well as you can see from the JETS 36 conference that was aired earlier as well.
Now, Bruce, what might be some of the areas where technology can be useful in the work that you do? Can you share some examples where you're currently actively employing AI in your work?
Yeah. I think earlier in the footage, we saw the word early intervention flash past, right? So that is one area where AWA is exploring the use of AI-powered video analytics to help practitioners document key behavioral outcomes of children who are undergoing early intervention. So you can imagine with heavy caseloads, a lot of the times the practitioner relies on their memory recall to document some of these behavioral indicators. So with AI-powered video analytics, this is captured. It improves and helps with intervention planning. It builds staff confidence, and it raises overall practice standards, right? So another example I share is my own example. So I don't support clients directly. I support employees who support clients. So recently in an employee engagement workshop, I got the feedback, both qualitative and quantitative handwritten feedback from 80 people managers. And I used Copilot to run through, and it surfaced an insight I probably missed if I did it manually, which was the normalization of burnout. So, basically, in a nutshell, the use of AI or tech is not meant to replace the empathy provided by the practitioners. It's meant to give them some of the time and energy back for them to practice some of these empathy.
So keeping that in mind, Stephen, what does effective training then look like for healthcare workers, especially those of them on the front line? How will the union be helping them?
Right. I met up with the management before, and that's what he told me. I say sometimes it's very difficult for an outside person to tell the domain players exactly what they need to do. Outside person, as in, for example, an IT person. So maybe it's better for the domain people itself to learn about AI, and then from there come up with some of the solutions. So, and this is what we actually refers to as AI bilingualism. So it's best combining domain together with the AI expertise as well. And over here, I probably also want to add trilingualism. It's not just about AI, it's not just about domain. I think importantly, you also at the back of every healthcare workforce to also think about sustainability as well. So I think the best is to also do a AI literacy for the healthcare workers, because every one of us will have different levels of expertise. And then once the company is ready and that mesh against the literacy of the people itself, then we'll be able to curate courses that are relevant to them, and then be able to implement projects that are relevant to the hospitals.
Stephen, Bruce, thank you so much for sharing your views with us. That was Bruce Liu, who is Senior Director of Disability and Inclusion at AWA, as well as Stephen Goh, Executive Secretary of the Healthcare Services Employees Union.